I'm Kat Hashway, and I'm an alumni of the OCD program at Bradley Hospital. Through the grapevine, I've heard that some therapists and doctors don't want to refer their patients to exposure therapy because they think it's mean or torturous. This concerns me because I can tell you from experience that that's not true. Even though it took us a while to find the gold standard treatment, the idea behind exposure therapy is relatively simple. It's literally no different than facing your fears. It's jumping off the diving board, it's going on the roller coaster, etc. The more you do it, the less scary it is. And it even becomes fun or a neutral activity for you. It works because of the process of habituation. Like when you move to the city and at first all you can hear are the cars rushing by your house all the time, but you get acclimated to it and then you can't hear it anymore. You sleep soundly. It's literally the same process that happens when we face our fears. Yet for anxiety disorders, we usually don't treat them that way. Why not? We think the anxiety is too severe, and for good reason. Yet the brain acts the same way for healthy fear as it does for disordered fear. It's just kind of amplified for an anxiety disorder. So instead of facing fears, we tell patients that there's nothing that they can do, and all that they can do is learn how to cope with it. I know this from experience. When I was 6 years old, I had my first experience going to a counselor. She said I had severe anxiety. Okay. But I kept going to see her on and off until I was 16 and found the OCD program. A decade of struggling and desperately coping and letting anxiety make my decisions because no one told me I could fight back. Instead, with their behavior and their language, they told me the opposite. When I first entered the program, it was scary, but I went along with the easier exposures they gave me. Not because I really believed they would help, but just because I was trusting the program. I was kind of ambivalent about the whole thing, and there were some things that I downright refused to work on. But as I kept going, I started to see how many things that I could do without anxiety that before coming to the program, I couldn't do at all or without tolerating a lot of anxiety. It clicked. And from that point on, I was all in. So all in that now I make YouTube videos to try to educate people about exposure therapy, so maybe they can get a head start in their recovery, you know, a little faster than I did. And I've come to see that doing exposure is a lot like exercise. In the moment, it's hard, and it leaves you breathless. But later, you're stronger. And not only do you feel better, but you can do more things than you could before you started working out. So the things that were hard for you at first become easy. You add more things, and you get stronger. On the other side of things, to not refer a patient to exposure therapy because it's hard, you might laugh at this, maybe this isn't a great comparison. It's kind of like a kid coming in with a nasty broken arm and saying, well, I could fix this, but it'll hurt at first. So I think you're just gonna have to learn to cope with it. Sorry about that, kid. The problem with that is the broken arm already hurts. OCD hurts. OCD is torture. But through exposure therapy, I learned that my feelings aren't threatening and I can do things even when I'm scared. Think back to all the times that you did things even though you were scared, and you'll see what a vital skill that is. And that's a skill that patients with OCD lack. Tolerance of discomfort. Not referring someone just prolongs the pain of an OCD sufferer so that when they do get help, they end up crying to their therapist asking why no one told them that there was an effective, excellent treatment for their disorder. It's why some people suffer for decades of their life. Yeah, exposure therapy is hard, but living with OCD is much harder.